Hello, good evening to everyone. I am Elango from Trichy. I am really pleasure to take this class for the nursing students in statewide. So I hope that it will be very helpful for the nursing student to understand about the midwifery and obstetrical nursing. So far we have seen 10 video teachings. This is the 11th one. From this onwards, the total videos will cover the total portion of midwifery and obstetrical nursing. So this is very helpful for the nursing students. At the same time, this video gives some short and sweet informations, and also the students, those who listen this video, can attend the MCQ type of questions, and they can answer very easy by means of listening this video. Let's go to the topic now. This 11th video starts from the midwifery and obstetrical nursing. The first portion about the female reproductive system. You know that many things, the reproductive structure, which are ovaries, fallopian tube, uterus, cervix, and vagina, and many things. We don't want to spend a lot of time over this. Each and every my videos is less than 10 minutes videos. This one is about the menstrual cycle. This menstrual cycle, ovarian hormone is actually the follicle stimulating hormone and luteinizing hormone. There are two different types of hormones which activate. And also the ovarian changes is pre-ovulatory phase and luteal phases. Uterine changes is menstrual phase and proliferative phase and secretory phase. Okay, you can see the picture here, the hypothalamus and gonadotrophic releasing hormone, which stimulate that secrete to FSH and LH that acts on ovary. The ovarian hormones like estrogen and progesterone secretes. And this is the way the Graafian follicles form, and ovulation starts, and that changes into the corpus luteum, and that is called degenerating process. There's a menstrual repair. The bottom you can see the menstrual repair, proliferative and secretory luteal phase. This is the gynecoid pelvis. The gynecoid means the womanly pelvis. The womanly pelvis, we can say. The delivery is very easy with this gynecoid pelvis. This is meant for delivery. You can see the transverse diameter, oblique diameter, and anterior posterior diameters. Let's see the details in the following portions. This is about the landmarks of the pelvis. The number one, you can see the sacral promontory, that is in the mid portion of the sacrum, and the second is sacroiliac joint. You can see the joint between the sacrum and iliacus. The third one is iliac crest, the flat portion, the flat bone of the iliac crest, you can see. The fourth one is the oblique diameter that you can see. Then fifth, number 5, you can see the transverse diameter. Number 6 is the anterior posterior diameter, that also you can see. The 7th one is the symphysis pubis, the front portion of the 3 important bones. Then 8th one is the ischial spine, which is very, very important for the pelvis outlet. This shows the station. This indicates the station. Okay, so this is about the zygote stage. Different stages. Here there is a ovulation. The ovum comes out. The fimbrial end, only one single fimbriae, that is called ovarian fimbriae, is attached with this ovary that you can see in this picture. And this ovum is get into the fimbrial ends and goes inside, and immediately in the first portion of the tube itself, fertilization taken place here, and that goes into sweeps around along with the fallopian tube, and that multiply into 2 cells and 4 cells and multiple cells, and that goes into the body of the uterus for the placement. It is called zygote stage. This is about the fetal development. There are 3 different type of fetal, you can say, the period: pre-embryonic period, embryonic period, and fetal period, you can say. The pre-embryonic period is up to 2 weeks, called pre-embryonic period. From the conception up to the 2 weeks called pre-embryonic, and the embryonic period says from the 3rd week and till the end of 8th week is called embryonic period. The fetal period starts after the 8th. That means from 9th to till the time of birth is called fetal period. So there are three types of fetal development: pre-embryonic, embryonic, and fetal period. Okay. Yeah. This is about embryonic period. That is week 1. This is week 1. Okay. The blastocyst is free floating. It has not been fixed in the uterus. It is free floating first week. The second week is 2 mm in length. Actually, groove form along with the middle back. Blood circulation begins in this 2 to 3 weeks, and this heart is tubular in shape. Heart is tubular in shape. Week 5, you can see the picture. Embryo is 4 to 6 mm in length. Embryo is 0.4 grams only. Double heart chambers are visible, and heart begins to beat. Limb buds forms well. This is 5th week. Then this is week 8 that you can see. Embryo is 3 centimeter in length, weight about 2 grams. Eyelids begin to fuse. The circulatory system through umbilical cord is well established. Every organ system is present in week 8. Fetal period of 9 to birth. This is fetal period, that is week 12. You are seeing the picture shows week 12. Okay, the fetus is 8 centimeter length with 45 grams weight. Face is well formed. You can see the face there, and limbs also you can see long and slender limbs. Kidney begin to form urine. The spontaneous movements occur in this 12th week. Heartbeat is detected by Doppler transducer between 10 and 12 weeks. In this week, you can't see the fetal heart rate with the help of your traditional fetoscope. You can see only by the Doppler transducer. Sex is visually recognizable in week 12. This is particular. This questions may be in your MCQ type of question. So many MCQs are in this picture that you can take it. Week 16, active movements are present. Fetal skin is very transparent. Lanugo hair begins to develop. The skeletal ossification occurs. The lanugo hair is the soft, first time occurring hair all over the body, which starts to begin in week 16. Then this is fetus 19 centimeter length. Week 20 says, week 20, fetus is 19 centimeter length, nearly 500 grams, that is 465 grams weight. Lanugo covers the entire body. Lanugo is the soft projection of the first hair appear on the skin is called a lanugo. This is present in the entire body. Fetus has nails. You can see the picture. The baby is biting and keeping the finger in the mouth. Muscles are developed. Enamel and dentin are depositing. Heartbeat is detected by a regular, that is non-electronic fetoscope. You can see you can watch the fetal heart sound by your fetoscope in week 20. Okay, yes. Then you can see the fetus is 28 centimeter length. Fetus is 780 grams. Hair on head is well formed. Skin is reddish and wrinkled. Reflex hand grasp function. Vernix caseosa covers entire body. The vernix caseosa is the cheese like a white matter all around the skin, which gives the better protection for the fetus as well as even after the birth. That gives a lot of immunity to the baby. And fetus has ability to hear. You can talk to the baby. The mother and nurse can talk to the baby in week 24. This is about week 28. Let's see this particulars in the following video. The first maternity video is finished now, going to end, and the second video starts with the second part, that is 12th video. Okay, yes. Thank you so much for your watching.